All right, so a very good afternoon to everyone. So today, Dr. Cheong here. So from Pro-Medic Clinic, I'm going to give out a topic on dengue fever. So why dengue fever? Because of course we can see the rainy days is coming. So there's whenever there's rainy days, there will be increase of mosquito breeding. Of course, I'm sure everyone knows the prevention on how to avoid that, because unfortunately there's no medicine, no direct medicine cure for dengue fever. But there are some ways that we can help ourselves to improve on the symptoms of dengue fever, which I'll be talking on later. One of some of the common remedies as well that is being used in Malaysia, whether it's approved or not, or even whether is it working or not. Okay, so without further ado, let me just continue with the dengue fever. So first of all, what is dengue fever? It's a vector-borne disease. So basically, it's through another medium, which is the mosquito that, as we know of, which is Aedes aegypti. So that is the mosquito, that only species of mosquito that able to carry the dengue virus, which is also we call it virus. Then, so it's an endemic in Malaysia. It happens throughout the year, okay, especially during rainy days. So it's especially because on normal days there are still mosquitoes as well. So there is whenever there's mosquito, there will be dengue fever. So also known as breakbone fever. Okay, so why is that? Because of the symptom. You get very bad bone pain, okay, or even muscle pain, or we call it as myalgia. So all these are the symptoms, and there are contains of 4 serotypes. So why do we talk about 4 serotypes? Is because some dengue symptoms may not be so severe. It can be very mild because the first time you got the virus, but most of the time, if you get the first serotype, you develop this antibody, then you get, let's say you get the second time, you get number 2, then this antibody that you have, it may cause severe problem. Although antibody is supposed to protect us, but being said that, let's say if you got a second episode of dengue, you may not recover from it, and you may get severe form of disease as well. Okay, so let's identify first. So a lot of time, I get bitten by a mosquito, would I just straight away get dengue? No, only Aedes aegypti. So as you can see, how to recognize, a lot of times we know the white pattern on their legs, but there is another species of the mosquito also has that. But the very, very typical sign of Aedes aegypti is actually on the thorax as well. You see, it's actually on the thorax. You see the head, as you can see, then there is the thorax, the tree-band. In Aedes aegypti, it's also referred as tree-band mosquito. As you can see on the thorax, which is the body, there is this 3 distinction line. As you can see here, it's actually 4, but then they call it the tree-band. So they must have this on the thorax. Only is called, it is the Aedes aegypti, which can transmit on dengue fever, chikungunya, Zika fever, and also yellow fever. So this is Aedes aegypti. If you see a brownish type of mosquito, if you're bitten by that, you won't get a dengue. Don't worry about that. So symptoms, we actually divide it into 3 phases. We have the febrile phase, critical phase, and also recovery phase. So how do we divide that? And usually is, as you can see, there's a summary on table on the right. So what happens is when you come into febrile phase, febrile means fever. When febrile phase usually lasts for 1 to 4 days. Okay, 1 to 3 days. Okay, this is the first few days that you get febrile phase. You get high grade fever, as you can see there, 40 degrees Celsius. Then because of the fever, you get dehydration, and the virus load will be increasing. Then in the middle, which you can see, 3 to 6, which usually lasts for 48 hours, which is the critical phase. That is the most dangerous time. Okay, when does this happen? Is when our fever subsides. So I'll explain furthermore in the later slide. Then after 48 hours, if you come out from that, you will move on into the recovery phase, which is the reabsorption of fluid. That usually will last for another 3 to 4 days until you fully recover. As you can see, also in the recovery phase, you can see the platelets slowly will come up. Okay, so that's a recovery of the part. And during the critical phase, which is the platelet will drastically drop, this is where the danger sign will come out. This is where the most critical phase, because of your platelet drop, it may lead to severe bleeding. So first, we talk about febrile phase. So febrile phase, of course, febrile means fever. You get a high-grade fever. You get generalized pain, hence breakbone fever. Then you get very severe headache. Typically, you get this symptom called retroorbital pain. Orbital meaning is your eyes. Retro means behind. So there will be a pain behind your eyes. This is a typical pain that you can get when you have dengue. Of course, nausea, vomiting, and a very, very interesting rash. We call it island of white in the sea of red. So as you can see on the picture on the right side, island of red, the whole body become red, but you can see spots of white island. Okay, you can see. So this is a very typical picture. And of course, there's petechiae, meaning a small capillary break, a small capillary bleeding under your skin. You can see there is a very small, tiny blood underneath the skin. So these are during the febrile phase. So during this phase, of course, you get very high-grade fever. So this is when a lot of people will say, you're having fever, but you do not have any cough. But typically, sometimes dengue also, you may get some URTI symptoms. URTI meaning upper respiratory tract infection like sore throat, and even you get the flu as well. So all these are very small. But if you get high-grade fever, continuous fever for a few days, you are actually suspected of fever, dengue fever. Then next, we move on to critical phase, usually after 3 or 4 days. So it starts when your fever resolves. So let's say you already diagnosed you to have dengue. Suddenly your fever drops, your temperature comes down to normal. That is when you need to be careful. It lasts usually for 48 hours. During this phase, there will be leakage of plasma from blood vessel. What does this mean? This means that there will be fluid loss from your blood vessel. You see, our blood contains all our fluid inside. Typically, it's supposed to stay in the blood vessel, but it leaks out into your extravasation space. Example, underneath your skin, it leaks to your lungs, causing you to have difficulty in breathing. So causing fluid accumulation in chest and abdominal cavity, which is not supposed to have any fluid. So it causes depletion of fluid in circulation, causing your blood pressure to drop, reduce blood supply to vital organs like your kidney, your liver, your brain, and even your heart. And during this phase also, there will be sudden drop of platelets, which is the small cell that helps us to clot our blood. So when there's drop of platelet, it may cause severe bleeding. You may just have spontaneous bleeding. So this is a critical phase. This is the most dangerous phase. Let's say you are still under a follow-up from a doctor. If your platelet drop below 80, you have to be admitted. So other than that, you may have be checked, managed via outpatient. So next, during this critical phase is also when you have warning signs. So warning signs, if you do have it become dengue hemorrhagic fever, it's no longer dengue fever, dengue hemorrhagic fever, bleeding. So what are the warning signs? So first of all, abdominal pain or tenderness. You get persistent vomiting, clinical fluid accumulation, meaning that you can find fluid in your lung, you can get fluid in your abdomen. Mucosal bleeding, of course, bleeding from your nose, bleeding from the gum. Okay, of course, you feel lethargy as well. Liver enlargements, these have to be associated with the abdominal pain as well. So why liver enlargement? Because the virus itself, dengue virus itself, can directly attack our liver, causing hepatitis So these are the warning signs as well. So of course, lastly, laboratory finding increasing of HCT concurrent with rapid decrease of platelet count. HCT is hematocrit, which is to see how thick is our blood. And when it's become too thick, meaning all the fluid are lost, your blood become very concentrated, then there is drop in platelet. Like I mentioned just now, it drops below 80, you have to be admitted. So if there is no warning sign during this critical phase, you may be managed via outpatient. So these are the warning signs. So just remember, around the abdomen, easy to remember. If you get vomiting, you get abdominal pain, you get breathlessness, all these are the warning signs that warrant you to be admitted. So next, after the critical phase, you will go into recovery phase. So resorption of leak fluid. So example, just now the fluid that leaked into your lung, it will be reabsorbed into your bloodstream. So usually lasts for 2 to 3 days. Then during this phase is where the rash may occur again. And because let's say some of, dengue, when we manage the dengue, you have the best way, the only way is actually to get fluid, okay, to even from drips or drinking a lot of fluid. So when you drink a lot during your critical phase, then during your recovery phase, when the water reabsorbs, you may get fluid overload as well. So all this it can cause an edema as well. So this one thing that we need to make sure we need to look out for. And lastly, of course, any form of virus infection, when you recover, you will get fatigue as well. So these are the 3 phases of dengue. So how do you investigate for dengue? So this is where we need to know. So the best way is still through blood tests. So there is 2 common blood tests that we do. First of all is NS1, which is the antigen. Just like COVID, we test for antigen present in our blood. So next, when there is antigen, there will be antibody. So antibody, we have our IgM and IgG. So of course, it will occur, IgM will come first. So during the 4th day, okay, NS1, the antigen, it can detect as early as after the 1st day. When you start go into febrile phase, when you get fever, there will be the antigen, there will be the virus. After the incubation period, you can test for NS1. So next, we will test for your IgM or IgG, your antibody, on the 4th day onwards. So this is the time that we can confirm that there is dengue as well. Even NS1 also can use that to confirm. And followed by that, there will be a day-to-day full blood count, which is testing on your platelet. Okay, just to share some management when you are admitted. Okay, it may sound very scary, which is last time when I was working in the internal medicine department, we may need to take a blood up to 4 times a day for those critical phase, because we need to monitor closely on the platelet. So that is how much of blood you'll be taking 4 times a day. So try to avoid mosquito at all costs. All right, so prevention of dengue. So that is where we want to bring in avoid mosquito bite. So how do we avoid? The most easiest way, of course, is repellent, whether it's chemical or even the smoke. Then removal of mosquito breeding ground. So all the places that are able to store water, please do cover it or remove of any potential mosquito breeding ground. So, and of course, the mosquito larvae will be the one that it will breed in water. So next, interestingly, there is a dengue vaccine. It's approved in US and some of the endemic area, which is like Puerto Rico. It has not come to Malaysia yet. The dengue vaccine sounds like a Pokemon name, Denguaxia. Okay, so there is the name, and it helps to protect against 4 serotypes of dengue, okay, which is the typically the 4 serotypes that we have here as well. So the interval for dengue vaccine is 6 months interval, so 0, 6, 12. So up to date, because it's still a fairly new vaccine, a protection period is up to 6 years. So this is the dengue vaccine. Interestingly, there is already a working dengue vaccine is given to children, predominantly given to children staying in endemic area. Okay, next, common dengue remedies that you can find in Malaysia. So first of all, papaya leaves. Sure, a lot of people have heard about this. So traditionally, they use papaya leaf and boil it with water. So, and there is, in fact, a tablet form, medicated form being used in Malaysia, is an papaya leaf extract. And it's confirmed in a research in 2013 by IMR, Malaysian IMR, is able to increase platelet count. So this is, it actually helps when you have dengue. Then next, a very common dengue remedy in Malaysia is sea crab soup. Okay, so it's actually misguided, and there was no further research. And there is a theory suggesting that why sea crab soup able to help is because of the protein content. So it actually helps for any febrile or any fever recovery. There is a theory saying that if you use chicken soup, it's the same. You will get the same effect as sea crab soup. So this is predominantly one of the remedy in Malaysia. Then of course, next is turmeric. Turmeric, generally it has a very good antioxidant property. So same, because during fever, during any form of virus fever, your body will have a lot of oxidative stress. So turmeric will be able to help to reduce symptoms of fever as well. And this turmeric. And lastly, a very, very common herbal or traditional medicine in Malaysia, porcupine dates. Or okay, this is if those who does not know, is a thing that they took out from the porcupine, almost like a rock. Okay, so that is predominantly also used in a lot of different severe diseases, like even cancer. So that is a very expensive stone. Okay, it's also called as porcupine bezoar. So there are some research, a few research that shows promising antioxidant property. Ongoing research are still being carried out. So there are promising study, but unfortunately, because it's such an expensive medication, traditional medication, a traditional herb, is being exploited. There are a lot of counterfeit and fake product in the market, so you won't know whether you are getting the real or a counterfeit product. So this is the danger of taking porcupine dates as well. So all these are the common remedies. So if you do have more, please share in our comment. All right, thank you. So this is the dengue. Please do be sure to look out for it during this rainy season. Okay, protect your child. Okay, by using mosquito repellents. Get rid of all the potential mosquito breeding ground. If you are having any form of fever, please do visit the nearest clinic to get it tested. On day one itself, when you start your fever, you can already able to test whether is it dengue, and after that, your doctor will be able to manage accordingly. And do remember, when your fever subsides for dengue is where the danger starts. So be sure to look out for that. And the best treatment is to have enough fluid, to get more fluid, to drink more fluid, and even isotonic drinks, all those will work as well. Thank you very much. Okay, then any question? No question, I'm gonna ask. Yes. Okay, questions. IgG and IgM. Okay, what's the difference? Sure. Okay, so can you elaborate what is IgM, IgG? So maybe I'll go back. All right, so this one for internal use, because just now that I already stopped the recording. Just now that one I will put it up into Facebook and put it like as though it's live later lah. Then after that, I will put there as Q&A, put there for Q&A as well lah. These are the topics that we can group together later on. So now I stop the recording already. Later I will use this and put it up. Yeah, is it recording? Yeah, recording done, close already. Okay, so what IgM, IgG? Let me go back to my slide. Okay. Basically, you see, when we talk about antibody, even like our COVID antibody, we also talk about IgM and IgG. So these are the two types of antibody. Why IG? Immunoglobulin means antibody. Maybe for our own internal training, let me go to this. What is IgM, IgG? Dengue. So here. Okay, this is a very good diagram as well. I can see, right, the diagram? Let's see. Cannot see. Oh, yeah, sorry. I stopped the sharing content. Stop. Okay. I have to change the screen, but please use the mic to tell me whether you can see or not. Can see or not? Somebody use mic to tell me can see or not?
Can see, can see.
Very good. Okay. So, first of all, wait. This one also not good. But never mind, I'll show the NS1 first. You see, first of all, you see NS1 is just the antigen. It will come out, okay, on the first day itself. So on first day, you can see the NS1. Then after that, you see the blue color line first. Sorry, there's two blue line. IgM blue color line, the deeper blue will come out first. IgM will come up first. Then IgG, being the long term, will come out later. So as you can see, maybe after 6 days only we'll see more of IgG. But IgM as early as 4th day after from your fever, from the first day of your fever, you can see a rise in IgM already. So the difference between IgM and IgG is actually when it will come out and how long does it last. Maybe I'll show another diagram. This one. So first of all, you see NS1 will come up, then gradually come down. IgM, green color, will come up first. Then it will go off in, I think this is 90 days. Then you see IgG. After 5th or 6th day, it will come up, then it will last for long. So basically, let's say if I take COVID, again, I take COVID for everyone to understand better. After you take your vaccine, after a month, give it maybe a month, whatever left is IgG. IgM will come up first, then IgM will slowly decrease, then it will move on into IgG. Okay. Next question. No mic, can see. Oh. Okay. All right, any more questions? Okay, thank you, bye. I know who is this already, seriously. Okay, I'll end this. I'll end today's session early. Thank you for joining on such a short notice. So weekly CME, next week CME, there is somebody need to present already, but I forgot who. Somebody will present. I will point tomorrow. Next round we play. Okay, the next week I will appoint. Then whoever is appointed next week will appoint the next presenter. Okay, and also give the topic. All right. Thank you very much. I think that's all. We'll meet you all soon. Jason is on the way to Pyramid. And that's all. Thank you, folks. Bye. Good night.